In the following film, Nancy McLaughlin, a fourth-year BSc veterinary nurse, demonstrates how to use a towel wrap to restrain the feline patient. Now, two things before Nancy begins. First, a word of thanks to our sponsor Training Progress, which offers a training and quality management system which ensures your whole team is trained consistently to your practice protocols, improving outcomes and efficiency. Second, Nancy's film has been peer-reviewed by Alasdair Hotston Moore FRCVS, who will now explain a little more about restraining cats and how Nancy's technique fits in.
We're very pleased here to have Nancy showing us how to use the technique of towel wrapping for restraint of a cat. Just before we start, just take this opportunity to remind us that when we do restrain cats for veterinary procedures, we should always be careful to cause minimal stress to the cat. Very often cats respond well to less restraint rather than more restraint. And if we can use less restraint without causing stress, but allowing us to perform the procedure safely, then that is generally preferred. But of course, in many cases, we do need to use some form of physical restraint. And of those, towel wrapping can be a relatively low stress technique if we use it with empathy for the minimal period of time and with minimum fuss. Of course, on each occasion, the veterinary profession needs to make a decision as to whether minimal restraint, a form of physical restraint such as towel wrapping, or perhaps chemical restraint such as sedation is more appropriate for the individual situation, the individual cat. Having said that, towel restraint is certainly a useful technique and one that veterinary nurses and veterinarians should be aware of. And Nancy shows us nicely here how to use it for various procedures. So without further ado, over to Nancy.
Nancy, and I'm going to be demonstrating how to towel wrap a cat for restraint. This can be a useful method of restraint for particularly wiggly patients or nervous patients or fractious patients, and it's something that you might be asked to do in your first placement by the veterinary surgeon to assist for procedures such as blood sampling and placing IV catheters. First of all, if you've got things around your neck, which you might do, it's a good idea to take them off, because when you're restraining the cat, if the cat is upset, it's going to make them more upset if they've got a stethoscope banging against the back of their head. So once you do that, then we can move. All the windows and the doors are sealed so that the patient can't escape when you get them out of their carrier. And you'll also want to make sure that the area where you're planning to do your restraint is clear. Okay, now that you have a clear workspace, you're going to want to prepare things that you're going to need for the reason that you're restraining the cat. So if you're getting ready for a catheter, make sure you've got stuff set up for that, or taking bloods. Take a nice thick clean towel and then we'll lay it on the table. What I find is a nice way to do it is if you put the towel at a diagonal angle across the table. Usually your exam table doesn't have a window behind it, so it's a little bit easier. So if you have a bit of a diagonal there and you've got access to both sides of the table and both flaps of your towel. Next, you need to make sure to approach the carrier gently and calmly. Introduce yourself to the patient and get their attention. Don't just reach into the carrier with your hand. Sort of make a general behavioural assessment of the patient. Make sure that, you know, if the patient is hissing and spitting at you, you might need someone to help you get them out of their carrier. Now, when you have the patient on the towel on the table, make sure to give them lots of reassurance and try and keep them on the table. If you take your piece of towel at the front end, tuck it under their chin, try not to strangle them, so enough that they can't wriggle and escape, but not too tight, so you can get your finger underneath. And if you take one side and wrap it over, and then bring it round their bottom end, and then take the other side and wrap it over as well, you have a nice little kitty burrito, and sort of give the patient some reassurance she's been very good. And this will be perfect for if you need to take a jugular blood sample. Another option is you can use this for a cephalic catheter. Hi, I'm sorry. I'm just going to finish this example with a teddy because our glamorous assistant is over it. You can take out one of their legs whilst you're doing the wrap, and you have the option to have just one leg out and wrap their head in. Sometimes if you notice that the patient is trying to hide away, is a bit nervous, sometimes they feel a bit more secure when they have their head covered. Just make sure that if you're covering the patient's head, that you know where their head is, and that you're not putting your fingers in their eyes or obstructing them in any way, and you're free from getting bitten. So this can be an option if you want to raise a vein and hold a leg out, for example. It's the same method as before. I'll show you again. So keeping a hand on your patient, so the leg that you choose, bringing the towel underneath and hooking that behind the elbow, bring the other half of the towel and gently wrapping it over the head, bringing the towel across the body, bringing the other side of the towel across the body and securing at the end. And then you can safely restrain for an IV catheter. I hope this was helpful.